Extrapyramidal side effects, or EPS, are common with patients receiving psychotropic medications. If ignored or mistreated, these involuntary movement disorders can become chronic or lead to a more serious drug reaction.
So today we're going to run through the various kinds of movement disorders that our patients can have.
Being well educated about all of the extrapyramidal symptoms that can surface is essential. Some of the most common of these side effects include dystonia, dyskinesia, akathisia, and pseudoparkinsonian disorders. Dystonia involves a contraction of major or focal muscle groups, resulting in a rigidity and tension, often in the back or neck area. When this becomes severe, symptoms can include extreme shaking, difficulty with breathing and swallowing, or choking. Dyskinesia is a term used to describe abnormal involuntary movements. Specific symptoms include strange movements of the mouth, tongue, and jaw, and curling fingers and toes. If ignored, this type of disorder may eventually no longer respond to treatment. Akathisia can best be recognized in movements that depict a strong inner restlessness in the patient, such as pacing or constant movement of one's arms or legs. Because of this inner tension, these patients may be more explosive in temperament. Pseudoparkinsonian side effects manifest in a dramatic slowing down of movements. This can include slurred speech, a stiff posture, coarse motor tremors, and pill rolling of the fingers. These patients may also walk in a shuffle or with slumped shoulders.
But you seem to feel okay in your wrist and your elbow, but your shoulder feels stiff to me today.
Because extrapyramidal side effects can be common, caregivers should acquaint themselves with assessment techniques for determining their presence or severity. Such knowledge may prevent a misdiagnosis or serious adverse drug reaction.
The neuroleptic malignant syndrome often starts with worsening of the movement disorder, and if you ignore it or don't recognize it, you may have a desperately ill patient on your hands instead of simply an uncomfortable one.
But the greatest risk is to misinterpret the whole syndrome of restlessness with a worsening in their basic psychiatric condition. The tendency then is to prescribe more medication, particularly an antipsychotic, to try to treat what is thought to be a psychosis, when indeed they're simply getting a side effect from the medication.
Again, the rule of thumb in preventing adverse drug reactions is that whenever there is any change in a patient's physical or mental status, or in his or her medication, staff should be alert for signs of a potential negative side effect.
Okay. Again?
It's best to evaluate by process of elimination, holding all medications, taking vital signs, and notifying the nursing supervisor, doctor, and pharmacy is the best precaution.
So you feeling kind of hot?
Yeah, I get hot.
In assessing patients, physical reactions, such as rashes and swelling, should be noted. Checking pupils as well as their input and output levels is also important.
You have to look at them, and sometimes you really have to touch them and feel the tenseness in the arms, in the neck. You have to listen to their speech pattern. You have to listen to them when they tell you about their constipation, about their trouble swallowing, about these other things that happen to them.
Do you know what today's date is?
I think it's Wednesday.
Wednesday. And where are we right now?
County Hospital.
Checking orientation to time and place can help reveal a patient's mental status. All patient input should be taken seriously.
I don't know if the side effects are worse than the medicine itself.
There may be a tendency when you're working in this population for over a period of time is to minimize complaints that patients have, or to minimize how patients complain about something. And patients who have psychiatric problems are going to talk about the snakes in their stomach, maybe when they're having a heart attack. I don't know. They're going to give you a very strange, sometimes, history.
Patient feedback is crucial, as is never leaving a patient in their room alone who is showing signs of an adverse reaction.
Problems. Yesterday, he was sitting around and he was just rocking back and forth. This morning, I noticed that he started getting very stiff.
When caregivers suspect an adverse reaction, they must be assertive in their communication with doctors and other colleagues.